The common cold, that all too familiar foe of sneezing, sniffling, and the odd symphony of coughs, is, in fact, a great scientific mystery. This persistent irritation conceals a fascinating world of virology, immunology, and epidemiology beneath its surface. At any given time, numerous individuals from all around the world are combating this viral foe. The common cold is, well, quite prevalent. Although the common cold infection is typically harmless, it usually affects an adult individual around 2 to 3 times a year. In contrast, children may get infected with a common cold infection around 6 to 8 times a year. Moreover, it commonly occurs during winter months, typically during September and May. Common cold infections have always existed throughout the history of humans. On average, the common cold infection may last for 7 to 10 days, but its symptoms may last for more than 3 weeks. What is the common cold? The common cold, which is commonly known as cold, is a contagious viral infection that primarily affects the human parts of the upper respiratory tract, such as the nose, sinuses, larynx, and throat. The common cold is the most commonly occurring infectious disease in humans. There are more than 200 different strains of viruses that are responsible for causing the common cold infection in humans. Some of the most common cold-related viruses include rhinoviruses, adenoviruses, coronaviruses, and enteroviruses. History of common cold. How the common cold infection occurs was unknown before the 1950s. However, it appears that people have been suffering from this disease ever since the beginning of human history. The Egyptian Ebers Papyrus, which is the oldest extant medical literature, was written before the 16th century BCE. The symptoms and the treatment of the common cold disease are mentioned in this literature. In contrast, the name cold first appeared in the 16th century, and it was used for the common cold due to the similarity of this disease's symptoms with those commonly occurring in humans upon exposure to cold weather. Following that, in 1946, the Medical Research Council of the United Kingdom established the Common Cold Unit, or CCU. Later, the most common causative agent of the common cold infection, the rhinovirus, was discovered in this unit in 1956. Causes. Any virus that can cause inflammation of the membranes of the nose and throat can cause a common cold infection. There are more than 200 different types of viruses that can cause colds. However, rhinoviruses are the most frequent cause of this infection, accounting for almost 40 to 50% of all common cold infections. Alone, rhinoviruses have over 100 different strains responsible for causing common cold infections. Besides rhinoviruses, many other viruses can also cause this infection, including coronaviruses, adenoviruses, and many others. There is a common misconception about the cold that it is caused by cold weather or being chilled. However, in fact, the common cold cannot be caused by cold weather, but it can occur during the cold season, which may be because of the several facts, including schools, which are in session during the early fall to late winter season, thus increasing the risk for child exposure to the virus. Secondly, people usually prefer to stay indoors during the cold season. Thus, they are in close proximity to each other, which increases the chances of viral transmission from an infected person to a healthy one. Finally, low humidity in the cold season causes dry nasal passages, which are more vulnerable to cold-causing viruses. Risk factors. Various factors can increase your chances of getting a common cold infection, including close contact, season, and age. Whenever a healthy person has contact with an infected person, they can catch a common cold infection. Similarly, although this infection can occur anytime throughout the year, it is more common during the colder months from September to May. Age is the third major risk factor for common cold infection, as infants and young children who have a weak immune system can easily catch a common cold infection. That's why children are more frequently infected with cold viruses than adults. Transmission of common cold infection. There are 2 major ways of transmission for the common cold infection. These include the direct and indirect ways of transmission. Suppose a classmate or a teacher of your children is infected with the common cold infection. In that case, they may be responsible for transmitting the virus of this contagious disease to your children. For instance, when people infected with the common cold sneeze or cough, their nasal secretions or fluids, which may contain virus particles, are released into the environment in the form of aerosols or droplets. The virus in these droplets can stay active for a few minutes to hours, and it can be easily transmitted to a healthy individual if they breathe in a droplet-contaminated environment. Additionally, person-to-person transmission through direct contact can also occur. For instance, healthy people may catch a common cold if they touch surfaces or clothes contaminated by the viral particles released in the form of droplets or nasal secretions from an infected person. However, viruses cannot infect until you touch your nostrils, eyes, or mouth with your hands contaminated with the viral particles on surfaces, clothes, or in the air droplets. Finally, there has been no reported transmission of common cold infection from animals to humans. Similarly, there is no evidence to support the claim that recirculated air in commercial aircraft is a mode of disease transmission. Furthermore, the common cold infection caused by rhinoviruses is highly contagious during the first 3 days. Afterward, the disease's contagiousness decreases significantly. Symptoms. Symptoms of the common cold infection usually appear in 3 stages, which are early, active, and late. Early stage. This stage includes days 1 to 3 of catching the common cold virus. In this stage, infected people usually feel tickling in their throat, followed by sneezing, coughing, hoarseness, runny nose, and nasal congestion or stuffy nose. Active stage. This stage includes days 4 to 7 of catching the common cold virus. In this stage, infected people usually feel worsening in their symptoms, as well as headache, body aches, runny eyes, fatigue, and fever. Fever is more common in children. Late stage. This stage includes days 8 to 10 of catching the common cold virus. In this stage, infected people usually feel slight improvement in their symptoms. However, some people develop a nagging cough that may last up to 2 months following a respiratory infection. In some cases, symptoms of the common cold may get worse, and fever may return, which are signs of another infection or complication like sinusitis, pneumonia, or bronchitis. The common cold symptoms in infants and babies may include sneezing, coughing, runny nose, high-grade fever, irritability, loss of appetite, slightly swollen glands, and increased drooling or crying due to difficulty in swallowing and sore throat. Diagnosis. The common cold infection is generally diagnosed through physical examination or laboratory tests. Your healthcare provider may physically examine swelling in your nostrils, stuffy nose, swollen lymph nodes in your neck, and irritation or redness in your throat. In contrast, you may be recommended to undergo tests such as COVID-19, the flu test, or tests for other similar conditions. Your doctor may ask you for a nasal swab test, which involves rubbing a sterile cotton swab inside your nose and then detecting viral antigens, usually the rhinovirus presence, through real-time polymerase chain reaction in short RT-PCR. Treatment. Currently, there is no proper treatment available for common cold infection or to control its causative virus. However, treatments for symptomatic relief are available, including painkillers like acetaminophen, decongestants such as pseudoephedrine, and cough suppressants such as dextromethorphan. In most cases, the common cold infection is harmless and goes away on its own after completing its cycle. People have misconceptions about common colds. They think taking antibiotics can be useful in treating common cold infections. However, it is a viral infection, while antibiotics are prescribed against bacterial infections. Sometimes, suppose your common cold symptoms are not improving completely, and your fever is returning. In that case, you may have pneumonia, which can be viral or bacterial, and your doctor may prescribe you antibiotics only after proper diagnosis. Prevention. Several precautions can be taken to prevent common cold infections, which are proper hand washing with soap. Avoid touching your face, eyes, nose, and mouth, especially after visiting contaminated areas. Frequently clean your house surfaces of common use, such as floors, tabletops, and other similar places. Always follow a healthy diet to boost your immune system to fight off infections. If you enjoyed this video, don't forget to like, share and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.